Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Effective treatment of a chest muscle strain or tear, and how to tell.
Yeah.
What it is.
We're talking about the pec major.
Right, pec major. We're not going to talk about the minor. We're not talking about a complete tear. Complete tear, it's going to be bruising, and the tendon often pulls away from the bone.
It's pretty dramatic.
It's traumatic or dramatic, and
both.
and you're going to end up having to have surgery.
Sure.
So we're talking about you strain some of the muscle fibers, and very common. It happened to me, Brad. I was working with a patient actually, and I was stretching them, and it tore, and this was a common cycle with me. It would get better, and then it would get worse again. And we're going to show you today why that happened.
Okay.
So,
yeah, because I think this is a common occurrence, not just with you, Bob.
right. I've gotten people that have been talking to us online that
Sure,
have said this.
exactly.
By the way, if you are new to us, please take a second to subscribe to us. We have a subscription button here or here. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
Excellent.
In addition, Brad.
Yes.
Yeah, if you haven't already liked us on Facebook, please do so, because we give away lots of stuff.
And it's free.
And it's free, yeah. So today we're giving away the Art Tree acupressure mat and pillow. This isn't it. This is a box. This is it. Very well made, by the way. This is very well. They wanted the owners, to point out that this thing is well constructed.
Sure.
So they're giving away 5 of these. You just got to go to our site and fill out a little form. I got your email and
right, self-explanatory once you get there.
Yep. All right, let's go.
Let's get on with the strain, the muscle strain.
All right, let's bring Napoleon over first.
Yeah, good old Napoleon. What do you know today?
So, not as much. Okay, pectoralis major comes, the fibers come from, this is the sternum, the fibers come from here, and even a little bit from the clavicle, and they attach up onto the bone here, right up onto the humerus.
Right.
So,
they allow the humerus to adduct and
a little internal rotation too, Brad.
Yep.
So, this motion here. So when you're bench pressing, can you see how that's doing that?
Yep. They're contracting and bringing that humerus forward.
So let's go to the diagram now. Hopefully this will make sense.
We compare the nice skeleton to this beautiful drawing.
Here's the sternum. Here's the sternum.
In the way, Bob.
Oh, sorry. Here's the sternum. Here's the sternum. Here's this bone. Here's this bone. See how the fibers come up? There's the upper fibers and the lower fibers, and they attach into the bone here.
Which is right there.
Yep. The problem is after you've, can I have that red one, Brad?
Sure.
This is the common cycle you're going to see. After you tear the muscle, scar tissue heals, or forms. And it forms in a cross-hatch manner here, kind of a random fashion here.
Right.
And this is not as strong as if it would be like that.
So this is, let's say the tear is here.
Yeah,
if I'm understanding you right. So if the tear is here, or the partial tear,
right,
the scar tissue, if you do not do what we're going to explain, kind of
goes random.
Yeah, all over the place, and we need to get them to line up with the fiber muscle.
Yeah,
the fibers of the muscle.
It's not as strong, and that's what happens is it keeps re-tearing open, and that's what I found. I would work with this patient. I start feeling better, and all of a sudden, it hurt again.
It'd flare up again.
Yeah, it flare right up again. And I'm sure you weightlifters are finding this. I want to get back to weightlifting, but every time I do it, it starts flaring up.
You get that cycle going.
So you need to do what we call cross-fiber friction massage. That's the most important thing you're going to do.
Sure.
And a lot of times the tear is actually right where you showed, Brad. The tear is quite often near the armpit here, or it might be up near the clavicle here.
Sure.
You find the tender spot, and you're going to want to go across the fibers of the muscles. So you can see the fibers run this way. You're going to go across them. And what you're going to do, we can get rid of that now, Brad.
All right.
Generally, you want to have, probably the arm, you might be laying down and doing this, or if you're sitting up, have the arm supported. And
so you can relax the muscle fibers.
Yep, and usually a little bit adducted, the arm, a little bit abducted, a little bit out.
Out to the side.
Yep, and so you're going to just go in there, and you're going to use the 2 fingers, 3 fingers, finger on top of finger, some method here, and you're going to go across the fibers here. Now, I'm not...
More up and down.
Yep, up and down. I'm not lightly. I mean, you might start off lightly.
Sure.
But eventually, you got to get into the fibers of that muscle.
Right.
And to do so means you're pushing pretty hard.
Especially if you're one of those, if you've been lifting, you got a lot of mass or a substantial muscle mass.
Like Brad.
Strong like bull.
Yeah.
But you really got to get in there. If your fingers are not getting tired after about a couple minutes, you're not pushing hard enough.
Right. And usually the sign that you want to see is that after a minute or so, it starts to numb up. And if it doesn't, and it just starts hurting worse and worse, it might be a little bit soon for it. Maybe you want to put some ice on it and let it calm down.
Give
Maybe
it a
there's
day
too
or
much
two.
swelling there. But if it's not, that's what you want to see, is that it actually starts to numb, and the pain even subsides a little bit, and you can push even harder.
Right.
That's a good sign. That means you're starting to get on the right path. How long do you do it? Well, like Cyriax, the inventor of this, he would often have people do it for 20 minutes. Well, you can't do it for 20 minutes. It's just
Your
impossible.
fingers wear out.
Yeah, so you could do a few minutes here, a few minutes there. And I think
Right.
you can do it every day if you can tolerate it.
As long as, again, either it starts to feel, like, say you first start, the pain level is 0 to 10, 10's max pain. Say you start pushing on it, it's like at a 5 or a 6, but after 30 seconds to a minute, that drops down to a 1 or 2. Then you're just going to keep working on it until your fingers get tired.
Now, I want to show one thing, Brad, also, because one of the things you want to do eventually is you're going to start doing some stretching on the muscle.
Yep.
And by the way, to diagnose, one of these problems, a chest pain, chest stretch, strain, usually it's going to be tender in that area. One of the things that could simulate it is costochondritis, which is a whole different animal, but that tends to be more down here.
And more towards the sternum.
Yeah, more towards the sternum, more towards the cartilage there. Also, we got to make sure there's no heart attack.
Right.
But these are generally, it's going to happen after you lift or something. It's going to be
Pretty obvious.
Yeah, it's pretty obvious. Exactly right. Why don't you lay flat on your back, Brad? Here, I'll give you a pillow.
I'm good at laying flat on my back with a
noticed
pillow, and then I can rest.
So to check the upper fibers of the muscle, so we're checking this side here. All you do is take the arm back straight away from the body here, and I let it go down, and you can see he's actually quite loose. Someone that's tight might only go this high, far down.
Sure.
So you can see his fibers are nicely stretched out. Good job, Brad.
And one thing you can do is test one arm to the other.
Right. That's exactly what you want to do, because the side that you injured might be tighter.
Right. So look, test a good arm if the injured one should simulate the other one if it's feeling better and healing properly.
So basically, he's forming a T here. If you want to check the lower fibers of the muscle, then you make more of a Y.
Yep.
So and that one's you're a little tighter, aren't you, Brad?
Oh yeah.
See that? Now he doesn't go all the way down.
Yeah. That's because I don't say touchdown enough. Like
Yeah.
that.
Apparently, yeah, you're rooting for the Packers. So.
Oh,
All right.
Bob.
Why don't you come on up again, Brad? Why don't we go ahead and maybe do a stretch?
Yeah.
You got that rolled towel?
Yep.
Oh, there it is. This is a simple way to do a stretch. You could roll up a beach towel or something like that, or you could use a foam roller. But you can just
Yeah, the foam
lay on
roller
it.
works a little better probably, but not everybody has one, so you can use this, and they
you
work.
can go like this, and you can just bring your arms up and even put your hands behind your head like this, or put them out like this, and just let it stretch out over time.
And what I do in the clinic, and if you trust someone at home, you might have them do a gentle stretch here. If you don't push down hard, if it hurts, it's just a gentle stretch. Again, you have to really trust someone that's doing that.
And you certainly can do this in a doorway too, Brad. So let's picture the doorway right here.
Yeah. We're going to have a doorway we can roll out here
Yeah,
someday.
that's right. So you can put your arms on both sides of the doorway, and you can do it in different levels. You can do it high up like this and lean forward, and then we're getting some of the lower fibers.
Right.
You can do it right here, and then you're getting some of the upper fibers. And I suppose this would be upper fibers too, wouldn't it?
Right.
So going down low. So you're leaning into the...
You don't want to stretch it so hard that it's creating sharp pain, because then you're just going to re-rip it.
Right.
We just want a gentle stretch just to, again, get those fibers, the scar
Realign.
tissue to realign.
Yep.
So it's gentle, gentle stretch pain.
Now, the other thing that's really important, Brad, and this is where I think so many people run into problem with this, besides not doing the massage, they go back and they say, well, I'm going to start lifting again.
Right.
And they go way too heavy of a weight. If you're going to do, what I often do before I even do push-ups, Brad, is I do press-ups.
Yep.
So I go like this, and this stretches my back,
Yep.
and it warms up my shoulders.
Sure.
Or it warms up my chest.
So
So I do a bunch of these, and then I'll go in and do my push-ups.
Sure.
And you certainly can go to knee push-ups first, just to, again, start putting a little pressure on them.
Right. And if you're a guy and you're thinking, I'm not doing any girl push-ups like that, just do it when no one's watching.
Yeah, just do them at home, and don't worry. And then you can obviously progress to doing push-ups, and we even have the perfect push-up here, don't we, Brad?
Yeah, those are nice.
I think they're nice because they you know, it rotates with the arms, and you can go ahead and do. Maybe I'll do it on here.
I think so.
Now the thing is with these two, if you start with the shoulders or arms a little closer together, it is going to be a little more tricep.
Yep.
If you go out here further, it is going to be more chest.
Right.
So.
And you know, the other thing is you don't have to go all the way down if it's sore. If you can do half a push-up and then you start to feel that sharp pain, but if you do a half a push-up and it's pain-free or just a little bit, that's okay.
Very good point, Brad.
And then progress into the deeper, full push-up the way it should be done.
And obviously when you go back to, start the bench, you same thing. You maybe don't want to go all the way down. Just do some shallow ones first, lightweight. You know, eventually just slowly build up to it. I don't know if we want to show TheraBand or not. Probably not.
No, well, we could quickly here, Bob. As you mentioned it. I can't. So if TheraBand is a great way because it's not so aggressive, and here you can do some reverse flies to work on those fibers, and just to get them over. This would be more in the beginning, especially if you're lifting heavy weights. You know, you can work the press up like this, or like push-up motion. Okay, so these can be real useful in this phase of the recovery.
Okay, remember, Brad, we're not just pretty.
We're pretty ugly. Look at this.
We're pretty helpful and handy. That's in case it's a heart attack, yeah. All right, thanks for watching.
We can help.